At Prevent Blindness, we promote healthy vision and access to eye care for all. We educate people about protecting their sight. We advocate for strong vision policies at the local, state, national, and global levels. We empower the blind and low vision community and their allies, and we celebrate their achievements. Here's your host, Christopher Horde.
Welcome to Prevent Blindness's Focus on Eye Health podcast. I'm your host, Christopher Horde. In this month's episode, we have a special feature. We'll be talking with Dan Roberts, a pioneer in curating resources for the blind and low vision community on the World Wide Web. Dan is editor-in-chief of the Living Well with Low Vision project. It's a massive collection of resources that is available as part of the Prevent Blindness web presence. As always, we will feature news and announcements of interest to the blind and low vision community, healthcare professionals, policymakers, caregivers, and others. Keep listening. We start right now.
News.
Prevent Blindness declares August as Children's Eye Health and Safety Month. Children's eye health is a vital element of their learning ability and social development. Yet, a study based on statistics gathered by the U.S. Census Bureau only a few years ago found that little more than 50% of U.S. children are getting vision screening. This is why Prevent Blindness observes August as Children's Eye Health and Safety Month. We've gathered together many resources for parents, teachers, caregivers, policymakers, and more. The material includes educational toolkits, fact sheets, and videos to help keep you informed. We invite you to check out these resources at our website, or click the link in the show notes.
Feature presentation.
Well, to get started, I'm going to ask you to introduce yourself to our listeners and tell us a little bit about what you do.
Well, I am, first of all, my name is Dan Roberts. I'm author of the book, Age-Related Macular Degeneration, an essential guide for the newly diagnosed, which is a little out of date now. They asked me to write that back in 2006, and so it's up to date as far as medications go and that kind of thing up to that time. And that kind of helped me get known in the field, which really helped my outreach. I also was contributing author to a book for the American Occupational Therapy Association, so the professionals have a little respect for me. And along with about 100 articles in various publications about and books and that kind of thing. The word is around. I graduated from the University of Missouri with a master's degree in music education. I was a choir director the last 13 years of my life in theory and drama, teacher in a high school, that last part. And I was married. I got to mention my wife. I married my wife, Christina, while I was serving in the Air Force Band in 1968. So that was a few years ago. We just celebrated our 57th anniversary. And during that time, we've been kind of busy raising 3 children, 7 grandchildren, and 2 great-grandchildren. So that's who I am in a nutshell. As far as how I got started with this, in 1993, I was in my 22nd year of public school music teaching, fully intending to reach retirement by my mid-50s. But as you know, the best laid plans sometimes are interrupted. I supplemented my income back then with piano gigs on weekends. I'm a professional pianist, and directing church choirs and directing summer theater. Everything music teachers do on the side to supplement. And then in 1994, my entire future, everything I'd planned, just took a huge detour. I started seeing visual spots in my left eye, especially, which I thought were caused by burn-in from the copy machine at the high school. But when the spots didn't go away like they're supposed to, And I started noticing cars and things like that disappearing into those spots. I thought, well, there's something going wrong here, and decided to see a doctor. The next flashes I saw were into my dilated eyes as the examiner took photographs of my retinas. And the diagnosis that I received was probably the most difficult news I ever received, and that was that I was going to lose my vision. At that time, I, of course, thought I was going to go blind, and because nobody told me I wasn't, and that's one of my huge arguments that I've been fighting for the last 30-some years, is the fact that with macular degeneration and other diseases like mine of the central retina, you don't go blind, but you do lose significant central vision. Mm-hmm. If they'd have told me that, I'd have been better off. I wouldn't have planned on taking up the accordion again and hiring a monkey to join me on the street corners, make a little money on the side. But I figured, well, that's an option. I can still play piano. They'll be okay. But I still fell into a severe depression because you can't direct theater, you can't read music. At least I thought at the time. There are just so many things I would be limited to. And remember, this was the 90s. We hardly had the internet, let alone assistive devices for low vision people. There was nothing to help slow down the progression of my disease. The doctor injected a steroid into the tissue around my worst eye and told me there was nothing more that he could do. And he was right at that time. There was nothing else that they could do. And actually, steroids turned out to be the worst thing for my particular condition. And when I asked him if I was going to be able to last until retirement, well, he smiled sympathetically, crossed his fingers as if to say good luck, and left the room. That upset me, and especially my wife, quite a bit. Mm-hmm. I never went back to him. I thought that's not the kind of response I should have gotten. And as I look back, I was absolutely right. That is not the response you want to give to a patient. No. So I went to New York and found Dr. Yanuzzi, who was an expert in the field in my condition. And he, strangely enough, referred me to a doctor a half hour from my house for the final diagnosis. But I received the information I needed, and that was that, yes, I could very well lose my central vision. So I went into a depression for a long time, over about a year, I guess, and my wife finally said, quit crying about this. And I actually did break down a few times because I had my future planned. Yeah. And this was not in that plan. And I thought, what am I going to do? And she said, there's this thing called the internet. Back then. Maybe you've heard of that. And I said, of course I have. So get yourself a computer. I didn't even have a computer. Learn how to use it and see if you can find some help out there. Mm-hmm. So she pushed me right into my new world. After weeks of searching through the tangle of disorganized information and dead ends that you found on the internet at that time, and that's why they call it a web, it was just a mess. I discovered a little group of about a dozen people who had found one another through an email support group. And they called themselves MD List, standing for macular degeneration. And there were just 12 of them, all senior citizens, who had formed a little listserv, they were called at the time. I'm not sure if they still have those, but email discussion, much like it was the early social media. Yep. What it really was. But we had all lost central vision, and we're losing it from the central vision loss. And they took me under their wings, and I learned that there is life after this. You can still survive. You can do well through a combination of human support and learning how one can live and have a fully and fairly independent life in spite of visual impairment. So that pulled me out of my depression, and I was able to start helping others. And being a teacher, of course, the next thing I wanted to do is everything I learned, and we learned together with those other people. We decided we wanted to help others to learn that too. So we followed what we ended up, I called it the task of living with vision loss. Our tenets became TASK, which stands for tenacity, adaptability, support, and knowledge.
Mm.
We thought if we could follow those four tenets and stick to them, then, and that's the tenacity part, then we would be okay. And so we taught that to many people over the years. And by 1998, I had retired from the public school and my church music jobs. And they made me the owner of MD List. They figured, well, so you're doing all the work, you just be the owner, which didn't mean a thing, except I had to do all the work. And that grew over the next decade to nearly 400 people from more than 20 countries.
Wow.
We gathered more than 650 internet pages of documents, and our website averaged 2.5 million hits annually. And we had such a big response because we were the only ones out there. Today, that's not unusual to get that many hits, but at that time, I think there were only 5 or 6 people on the internet. We did extremely well. People found us only by typing in macular degeneration and then the word support, which ironically was our name.
Mm-hmm.
So we came up first every time somebody typed those 3 keywords, and that was purely by accident. We weren't smart enough to figure that out. We ended up incorporating in 1998 as a nonprofit charity under the name Macular Degeneration Support, or MD Support, and we acquired a 12-member professional advisory board to guide us and make sure we were telling the right truths. We had no advertising on the site. That's another reason people liked us. We didn't push for donations. Things just came to us. We had people that said, I want to help. And there were so many people that helped. That's what supported us. We also sold things over the internet. We had our own little store of low vision riffraff. We had coffee cups that said, I'm a macular degenerate, things like that, that people thought it would be fun to have. And we sold sweatshirts, and that's what paid our way in the beginning. And we eventually got corporate support.
Mm-hmm.
From several different corporations, which decided we were going to be able to help them as much as they could help us. And so we started helping by providing people for their clinical trials and sending people their way for information. And in 2013, a long time after, I guess, how many years is that? 20 years? This kind of thing, we merged. Because I realized, okay, I'm in my 70s now. And I'm not going to last forever, and this thing will go if I do, because I was kind of maintaining and doing everything as far as maintaining the website. And it was such new technology, even at the time, that nobody really knew how to take it over or what to do. It was so unique what we were doing. So I said, okay, Prevent Blindness and I got together, and that's another long story. But we did manage to get together where we felt like we could help each other. They were a 100-year-old organization. I was a 20-year-old organization. They said I had things that they wanted to do on their website that I was able to do, and I'd already put it together, so why not? And so we got together, and we ended up contributing all of our resources and contacts, all of those pages on our website and all those articles and things that we collected to their website. And we call it Living Well with Low Vision, which is part of the Prevent Blindness site. And to help maintain all of those resources, I was taken on as editor-in-chief, a position which I now hold simultaneously with my outreach through MD Support. I'm still director of MD Support, and we're still very heavy into supporting live support groups around the world, helping them reach folks who do not have internet access.
Oh, okay.
You realize there's a lot of people out there that can't find us.
Sure.
No matter how much good stuff we have. So we started out as an internet, the only service on the internet for low vision people as far as support, and ended up now sending that support monthly through presentations and handouts and educational materials, all planned out for them. So it's very easy to run a support group. Because we send their program to them every month, which turned out to be the hardest thing about running a support group.
Okay.
I'm beginning to ramble on, so I'm going to let you go ahead. If you have any questions, that's basically the story of what started it all and where we stand today.
Well, you've covered a lot in just a little bit of time, Dan, and I appreciate it. But let's, a couple of quick things. For folks who have not been to the Living Well with Low Vision website, can you give them a little idea of some of the resources they may find there?
Yeah, we try to answer the 10 basic questions that everybody has. And that's how I started. I said, what do I want to know? What are my questions? And now let's find out the answers to those. Put them out there where everybody can read them. And the first one was, what is AMD, or age-related macular degeneration? And how did I get it? So we had to tell them, teach about the research that was going on. And people want to know what to expect from the disease. They want to know how can they improve their own visual health. We have resources on that. We teach those kinds of things. How can I live successfully with visual impairment? There are lots of sites that have this information on them today. I'm proud to say we're the first one to have it all. To have it all in one place. And that's been the job that I've been doing for the last 30 years, is maintaining that. What kinds of doctors should I be seeing? What kinds of surgeries or interventions are available for people, not just macular degeneration, but other diseases of the retina, like diabetic retinopathy, for example. So we've branched out into those areas as well. What are the treatments and potential cures? I used to say, I'm going to do this until the year 2020 because that's a good year. That sounds like a really good year for a person with bad vision. And I said, I have a feeling the year 2020, we're going to have a cure for this. And so I said, okay, I'm going to commit my life until the year 2020. Well, that passed. And all the people that I thought would be passed on and gone, all these senior citizens I was working with, many of them are still with me in the little telephone support group I have. Some of them have reached 100 years old, and we're still meeting with the group. And so I can't leave them. So I'm still sticking with them as a support group over the telephone every month. And we are still putting information out over the internet and sending it then to the groups that don't have the information and don't have the computers. We also got into what are my rights as a visually impaired person. We got into the ADA and education about that. And then we have clinical trials. We help people learn where they are, what they can expect from a clinical trial. And then where could they find more help? Because we are still humble enough to say, okay, we don't know it all. There are other sites out there that can help them too. So we partner with lots of other sites, namely Hadley Institute. That's I think our most active partner. They do a lot of what we have been doing. And so in order to avoid doubling up, we do partner in a lot of things there. And there's some other good sites on there too, all of which can be found on our site. We send people to the ones that can help them. So our primary goal has been to ensure that no one will ever be alone with this disease, that they will not fear the future because they're going to know what's going to happen next. But the doctors can't tell them. And so we give them what to expect from our personal experience. And that's really what they want to know is, am I going to be okay? No patient should walk out of a doctor's office not having answers to all of those questions. And so we address those. Do you want to know how we address those questions? The kinds of sites that we have on the web?
Well, certainly.
Don't know how much time you have.
Well, we're probably running pretty quick on our time at this point. Probably the wisest thing to do, I think, is first to tell the folks the best way to find the Living Well with Low Vision site, but also MD support if they want to start their own support group or something like that. Why don't you give us all the information so folks can check it out?
Okay, for all of those resources that I told you about, those can be found on MD support because that links right to low vision, living well with low vision. So they're actually the same site now connected. So the easiest way would be go direct to the lowvision.preventblindness.org site. That's lowvision.preventblindness.org. And that'll take you right to those pages and pages of links. There's over 1,600 links to further information and other resources on there that we maintain. If they want to go to MD support, if they want to start a support group or need help with their support group, it's free. Everything we do is free. They can just go to mdsupport.org.
All right.
If they want information on any of that, they can write to me, director@mdsupport.org.
Fantastic. Okay, well, Dan, I want to thank you very much for coming on and sharing the information with us, and also for the work that you do for the community.
Well, it's kind of selfish. It started because I was upset,
I think we all experience that a little.
Yeah. And I thought, well, I like to teach, and now I know stuff that other people may not know, and that's what I like to do, is teach people things. And so that's basically why it started. And every time I taught, I learned, because any teacher will tell you, the best way to learn anything is to teach it yourself. So I tell everybody I help to now go out and spread that word, tell somebody else. And that's how we've grown and maintained our popularity over the last three decades.
All right. Well, thank you, Dan.
Thank you. I appreciate the work that you're doing here. You do some excellent webcasts, and I'm following every one of them.
Oh, thanks.
Announcements.
The 2025 Swing for Sight golf event is coming soon. Preparations are underway for Prevent Blindness's annual Swing for Sight golf event. This is the 17th year the charity event has been held. It will be held on September 17th, coinciding with the kickoff of Vision Expo West. Once again, the event will take place at the beautiful Bali High Golf Course in Las Vegas. The course has been named by Golf Digest as one of the top 50 resort courses. There's still time for golfers to register to take part in the tournament. Additionally, there are still some sponsorships available on a variety of levels. For more information, please check out the special page for the event at our website, preventblindness.org, or click the link in the show notes.
Listen to the podcast from our website at preventblindness.org or subscribe to it on all major podcast services, including Amazon, Apple, Spotify, and YouTube. This has been your announcer, Corey M. Snow.
This has been the Prevent Blindness Focus on Eye Health podcast. We'd like to add that we're a young podcast and always seeking opportunities to grow. If you know anyone that you think would find our podcast useful, informative, or enjoyable, we ask you to share our information with them so that they can check us out. Be sure to join us in September when we'll talk about some of the many fun things that blind and low vision people can explore to help improve and maintain their quality of life. As always, we will have news and announcements of interest to the blind and low vision community and their allies. Once again, thanks for listening. I'm your host, Christopher Horde. Share and enjoy.